My American dream involves living with bipolar type 1. And so this is the face of someone whose world has been transformed by mental health challenges.
Joshua Roberts is from South Africa. He says when he was 32 years old, his life changed following a bipolar disorder diagnosis.
6 times there I was on the inside of a psychiatric hospital in these yellow socks and a wristband, implying that I was sick in the head.
Roberts says it was spiritual-based mental health programs run by people with similar experiences that helped him.
I think that was the most powerful discovery for me, were spiritual models that reframed the way I saw my bipolar and the way that I saw myself, the way that I saw reality. And that's actually made my life way better now than it ever was even before. Come on, let's go.
Roberts was so moved by the experience that he now helps others in similar situations. He works with the San Diego chapter of the National Alliance on Mental Illness, or NAMI San Diego.
The power of lived experience is able to connect us to other people, and we can build real deep rapport. We're able to kind of say, hey, watch out, man, I fell down that cliff. You want to just maybe walk a little bit this way.
And he recently graduated from a NAMI program that's training people to use their mental health stories to impact policy. He's focused on expanding the spiritual treatments and peer support services that have helped him.
How the legislation works and who the government is. I always kind of thought they were just these abstract out there people. But then I realized they're just real people and that we can actually contact them. We can actually make these changes.
NAMI started the training earlier this year. It was made possible thanks to funding from San Diego County's Behavioral Health Services Department.
What we focus on is just making sure that these voices are amplified and that we are being heard.
Sten Walker is NAMI San Diego's Community Advocacy Program Manager. He says one of the best ways to affect change is by going directly to the policymakers. This program focuses at the county level.
Help them out because they don't know everything, so they need to hear this stuff. There really is something to having people with lived experience part of the conversation. And no matter how well-intentioned someone may be as a policymaker, as a doctor, or any sort of professional, there is something lost there when they aren't directly affected by it.
The next Smarts of Advocacy trainings are happening virtually later this month, and anyone can sign up. The program has funding to continue for at least the next couple of years. Matt Hoffman, KPBS News.